Welcome to today's pharmacology quiz on antiretroviral agents. In this video, we'll test your knowledge of the key drugs used in the management of HIV and AIDS, exploring their mechanisms and therapeutic roles. The quiz features 20 recall-type multiple-choice questions designed to reinforce essential pharmacology concepts. Each question includes 5 options, followed by the correct answer and a brief explanation to enhance understanding. The video will pause for a few seconds after each question, allowing you time to think before the correct option is revealed. So, let's get right into it. Question 1. Which of the following mechanisms of action correctly describes nucleoside reverse transcriptase inhibitors, or NRTIs? Option A. Inhibit viral protease cleavage of polyproteins. Option B. Incorporate into viral DNA causing chain termination. Option C. Block CCR5 coreceptor on host cells. Option D. Prevent fusion of viral envelope with host membrane. Option E. Inhibit integrase enzyme to prevent viral DNA insertion. The correct answer is option B. Incorporate into viral DNA causing chain termination. This is because NRTIs mimic natural nucleosides and are incorporated into viral DNA, halting elongation and preventing replication. All other options describe the mechanisms of different antiretroviral classes such as protease, fusion, and integrase inhibitors. Question 2. All of the following are common adverse effects of tenofovir except Option A. Renal toxicity. Option B. Fanconi syndrome. Option C. Osteopenia. Option D. Hyperlipidemia. Option E. Lactic acidosis. The correct answer is option D, hyperlipidemia. The reason is that tenofovir is not known to cause hyperlipidemia. Instead, it may even improve lipid profiles in some patients. Protease inhibitors are the ones typically associated with lipid abnormalities, while tenofovir more commonly causes renal and bone effects. Question 3. Protease inhibitors differ from NRTIs primarily in which pharmacological property? Option A. Inhibit viral reverse transcriptase. Option B. Require intracellular phosphorylation. Option C. Interfere with polyprotein cleavage. Option D. Cause mitochondrial toxicity. Option E. Bind CCR5 receptor. The correct answer is option C. Interfere with polyprotein cleavage. This occurs because protease inhibitors block the viral protease enzyme responsible for cleaving precursor polyproteins into functional proteins required for viral assembly. NRTIs act much earlier in the replication cycle and target reverse transcriptase, not protease. Question 4. Which of the following drug interactions is most significant with ritonavir? Option A. Rifampicin decreasing plasma levels. Option B. Omeprazole increasing absorption. Option C. Warfarin unaffected. Option D. Metformin causing hypoglycemia. Option E. Amoxicillin reducing efficacy. The correct answer is option A. Rifampicin decreasing plasma levels. This is because rifampicin is a potent inducer of CYP3A4 enzymes, which significantly reduces ritonavir and other protease inhibitor levels, compromising antiretroviral efficacy. The other listed drugs either have minimal or no clinically relevant interactions with ritonavir. Question 5. All of the following drugs are non-nucleoside reverse transcriptase inhibitors, or NNRTIs, except Option A. Efavirenz. Option B. Nevirapine. Option C. Rilpivirine. Option D. Emtricitabine. Option E. Delaverdine. The correct answer is option D, emtricitabine. The explanation is that emtricitabine is an NRTI, not an NNRTI, and it requires intracellular phosphorylation to become active. The other agents listed act allosterically on reverse transcriptase without the need for phosphorylation, distinguishing them as NNRTIs. Question 6. Which antiretroviral agent is preferred in pregnancy due to its safety profile? Option A. Efavirenz. Option B. Dolutegravir. Option C. Zidovudine. Option D. Tenofovir disoproxil fumarate. Option E, lopinavir. The correct answer is option C, zidovudine. This is because zidovudine has a long history of safe use in pregnancy and is proven to reduce vertical HIV transmission from mother to child. Efavirenz carries teratogenic risk, and other agents have limited data or less established safety profiles in pregnancy. Question 7. Integrase strand transfer inhibitors, or INSTIs, prevent which critical step in HIV replication? Option A, viral fusion with host cell. Option B, reverse transcription of RNA to DNA. Option C, cleavage of viral polyproteins. Option D, integration of viral DNA into host genome. Option E, binding of GP120 to CD4 receptor. The correct answer is option D, integration of viral DNA into host genome. This is because INSTIs block the viral integrase enzyme, preventing incorporation of viral DNA into the host's chromosomal DNA, an essential step for replication. The other options describe actions of different drug classes such as fusion or protease inhibitors. Question 8. All of the following statements about lopinavir/ritonavir therapy are correct except Option A, boosted by CYP3A4 inhibition. Option B, oral administration only. Option C, may cause hyperlipidemia. Option D, safe in severe hepatic impairment. Option E, can induce insulin resistance. The correct answer is option D, safe in severe hepatic impairment. The explanation is that lopinavir/ritonavir is metabolized by the liver, and severe hepatic impairment can lead to dangerous drug accumulation. All other options correctly describe its pharmacological profile and metabolic effects. Question 9. Which NRTI combination is preferred as first-line therapy for treatment-naive adults? Option A, zidovudine and lamivudine. Option B, tenofovir and emtricitabine. Option C, abacavir and efavirenz. Option D, didanosine and stabudine. Option E, lamivudine and nevirapine. The correct answer is option B, tenofovir and emtricitabine. This is because the tenofovir-emtricitabine combination forms a potent, once-daily NRTI backbone with excellent tolerability and resistance profile, commonly used as part of first-line regimens. The other combinations are either outdated, less effective, or associated with higher toxicity. Question 10. Which adverse effect is most associated with abacavir? Option A, renal failure. Option B, hypersensitivity reaction. Option C, osteopenia. Option D, peripheral neuropathy. Option E, lipodystrophy. The correct answer is option B, hypersensitivity reaction. This occurs because abacavir can cause a potentially life-threatening hypersensitivity reaction in patients with the HLA-B*5701 allele, requiring genetic screening before therapy. Other listed adverse effects are linked with different antiretroviral agents rather than abacavir. Question 11. All of the following therapeutic principles are important for antiretroviral therapy except Option A, use at least 3 active agents. Option B, avoid monotherapy. Option C, monitor viral load regularly. Option D, discontinue therapy during minor illness. Option E, ensure adherence to dosing schedule. The correct answer is option D, discontinue therapy during minor illness. This is because antiretroviral therapy should be continued consistently to prevent viral rebound and resistance, even during minor illnesses. Stopping therapy unnecessarily can lead to treatment failure and loss of viral suppression, unlike the other principles which promote sustained efficacy. Question 12. Which of the following drugs directly inhibit viral fusion? Option A, Mariviroc. Option B, efavirenz. Option C, lopinavir. Option D, zidovudine. Option E, dolutegravir. The correct answer is option A, Mariviroc. This occurs because Mariviroc binds to the CCR5 receptor on host cells, blocking HIV's ability to fuse with and enter the cell. The other listed drugs act at different stages of the viral replication cycle, not at the fusion step. Question 13. Which pharmacokinetic property is unique to ritonavir boosting? Option A, decreases half-life of co-administered drugs. Option B, inhibits CYP3A4 increasing plasma levels. Option C, enhances renal clearance. Option D, induces glucuronidation. Option E, reduces bioavailability. The correct answer is option B, inhibits CYP3A4 increasing plasma levels. The reason is that ritonavir acts as a potent CYP3A4 inhibitor, thereby increasing the plasma concentration and duration of action of other protease inhibitors. The other options describe metabolic effects that are opposite or irrelevant to ritonavir's boosting mechanism. Question 14. All of the following drugs are associated with hyperlipidemia except Option A, ritonavir. Option B, lopinavir. Option C, atazanavir. Option D, efavirenz. Option E, tenofovir. The correct answer is option E, tenofovir. This is because tenofovir tends to have a lipid-lowering effect rather than increasing cholesterol or triglyceride levels. In contrast, protease inhibitors and efavirenz commonly cause hyperlipidemia as part of their metabolic adverse effect profile. Question 15. Which antiretroviral agent is contraindicated in severe renal impairment? Option A, zidovudine. Option B, tenofovir disoproxil fumarate. Option C, lamivudine. Option D, abacavir. Option E, efavirenz. The correct answer is option B, tenofovir disoproxil fumarate. This occurs because tenofovir is primarily excreted by the kidneys and can cause nephrotoxicity and Fanconi syndrome, making it unsuitable for patients with severe renal impairment. The other agents are either metabolized hepatically or have safer renal profiles. Question 16. Dolutegravir differs from raltegravir mainly in its Option A, resistance profile. Option B, oral absorption. Option C, ability to inhibit reverse transcriptase. Option D, hepatic metabolism pathway. Option E, renal excretion. The correct answer is option A, resistance profile. This is because dolutegravir has a higher genetic barrier to resistance and maintains efficacy against some raltegravir-resistant viral strains. Other pharmacokinetic features are similar between the two agents, making resistance profile the key differentiating factor. Question 17. All of the following are clinical uses of maraviroc except Option A, CCR5 tropic HIV infection. Option B, post-exposure prophylaxis. Uses of maraviroc except Option C, treatment-experienced HIV with resistance. Option D, monotherapy in naive patients. Option E, combination with other ARVs. The correct answer is option D, monotherapy in naive patients. The explanation is that maraviroc must always be used in combination therapy because monotherapy leads to rapid resistance and treatment failure. All the other uses align with its role in CCR5 tropic or resistant HIV infections. Question 18. Which of the following INSTIs is preferred for once-daily dosing due to long half-life? Option A, raltegravir. Option B, dolutegravir. Option C, alvategravir. Option D, maraviroc. Option E, efavirenz. The correct answer is option B, dolutegravir. This is because dolutegravir has a long half-life of around 14 hours, allowing for once-daily dosing without the need for pharmacokinetic boosting. Raltegravir requires twice-daily dosing, and alvategravir needs boosting with cobicistat for optimal plasma levels. Question 19. Which adverse effect is most commonly associated with efavirenz? Option A, rash and hepatotoxicity. Option B, CNS symptoms and vivid dreams. Option C, osteopenia and nephrotoxicity. Option D, lipodystrophy. Option E, hypersensitivity reaction. The correct answer is option B, CNS symptoms and vivid dreams. This is because efavirenz readily crosses the blood-brain barrier, leading to side effects such as insomnia, vivid dreams, dizziness, and mood changes. Other adverse effects listed are characteristic of different antiretroviral drug classes. Question 20. All of the following are monitoring parameters for antiretroviral therapy except Option A, viral load. Option B, CD4 count. Option C, liver function tests. Option D, serum creatinine. Option E, blood glucose daily. The correct answer is option E, blood glucose daily. This is because daily blood glucose